Anyone know what's happening with that fire out by Warm Springs?
It's still raging.
Oh,
Yeah, I think the wind must have shifted because we're not having the smoke here in Bend, but it was pretty bad the other day. So
yeah, there was some indication that smoke would blow into the Portland area, but I don't see any signs of that yet.
I believe we're already in fire season again.
No.
Yeah, it's brutal.
Mm-hmm.
After year.
I'd say probably another 30 seconds or so, Chris, and then we can start doing some of the opening work. And I think as people filter in and everything, if that's cool with you.
That works for me.
Okay.
Looks like we still have some folks streaming in.
No. Yeah, I think my count is that we have 11 committee members, so that's pretty good. I think 11 out of 15. Hey, Michael.
Hello, good afternoon.
Yeah.
So step on the gas pedal.
Do it, Chris.
All right. As they say in my community, the without gas. So welcome everyone. Thank you for participating in our Equity and Mobility Advisory Committee for the I-5 and I-205 tolling projects on behalf of the ODOT team. We very much appreciate your time and commitment to this process. We're going to start off with a centering exercise, as we usually do for these meetings. So I want to ask everybody to please close your eyes or gaze softly downward. Feel the chair under your legs. Breathe in deeply through your nose. Hold a moment, and then breathe out through your mouth. Feel your hands in your lap, and breathe in deeply through your nose again. Hold for a moment, and then breathe out of your mouth slowly. Feel your feet on the ground. Breathe in deeply through your nose. Hold for a moment, and then breathe out of your mouth slowly. Now slowly open your eyes and breathe normally. So for those of you that don't know me, I mean, I know some of you or most of you on the committee know me pretty well by now, but my name is Chris Lepe, and I'm a principal at Mariposa Planning Solutions. I'm the project team helping to advance equity through the project, and I've been involved in this project since late 2019. And although you've seen me present and facilitate discussion at various EMAC meetings, today I'm stepping in for Jessica Stanton in her role as the overall facilitator for these EMAC meetings during her absence. So before we continue forward with our meeting, I'm going to pass it along to Garrett for a brief moment of silence.
Sure. We've been just struck with some heart-shattering news this a few weeks ago that our facilitator, her partner, Chef Michael Stanton, passed away due to complications with cancer. And it's just been tough because the quality of person that you see at these meetings or that you've gotten to know in conversations through one-on-ones is just the tip of the iceberg as far as the quality and depth of a human being that she is and where she shows up each day into every conversation. And so to see her go through this, to be missing her as we've been planning this past month has just been a really tough time on us, on the project team. And so, and our hearts are just broken for what Jessica is going through now. So can we just take the next, just take a moment to remember Chef Michael Stanton, and just to send our thoughts out to Chef Michael and Jessica and their family and friends at this time. Right. Thank you for taking that moment. I have heard from Jessica. She is excited about returning to the work. I think we'll see her at our July meeting and maybe some time leading up to that. But thank you for taking that moment of remembrance. And so, Chris, I'll pass it to you now to walk through technical information.
Thank you for that, Garrett. So when it comes to technical help, as you all know, Nick Fazio is the person to go to. Please note his phone number and his email in case you need it later. We will be recording the entire meeting, so what you say is part of the public record, and the record will be made available for public review next week. To find more information about the project, please go to OregonTolling.org. And for community members, you're welcome to email your public comments to us at OregonTolling@odot.state.or.us. So we have quite a few working together agreements, and I think it's important to recognize some of those as we go into the to our meeting here. I'll just call out a few. First, speak your own truth with compassion. Listen to understand. Don't listen to respond. Value and celebrate each other's experiences. Make space, then take space, and be concise. And attack the problem, not the person. So getting into our proposed outcomes, there's two key outcomes that we're really after with this meeting. The first is better understanding within EMAC of policy and strategy options for neighborhood health and safety that will be prepared for EMAC's July meeting. So we're going to be diving into neighborhood health and safety today as well as next month. And this is going to be, as we'll talk a little bit later, really EMAC driving the conversation and ODOT being of service to you. The second piece is providing feedback to ODOT staff on the study of potential impacts related to neighborhood health and safety. And so for our agenda, we're going to talk about where we have been and where we are going. Today's meal, really the meat of the matter, neighborhood health and safety, followed by breakout room discussions, and then coming back into the large group to recap and see if there's any areas that we're gelling, and any sort of direction for ODOT staff and next steps, and then finally closing. So next we're going to get into, in our first item of the agenda, we're going to talk about where we have been briefly and where we're going. And as you know, the last 2 months, we have focused on transit and multimodal. This is the first month really where we're really focusing in on health and safety. And so we'll spend, as I noted, June as well as July on health and safety. And then the following couple months, we'll be focused in on affordability and transportation. After that, in the fall, the EMAC will present to the OTC these various different recommendations coming out of these three buckets.
And Chris, can I just build on one thing on that slide?
Yeah.
So for those who thought, what's happening with that transit multimodal work that we did. So just a week ago, we met with all of the regional transit, carpool, van pool, mobility providers. They took your language and they're starting to now add information underneath it. So what would it take to implement, to deliver those services on day one? And how is this advancing equity? And so we're going to compile this information, and then around August or September, you're going to see us send that information back to you all, either at the committee or probably we'll form a subcommittee that then works from August through October in really developing this recommendation for the OTC. And so what'll happen is you'll see, kind of like Chris talked about, this 2-month iterative process where we kind of what are our favorite ideas from each one of these areas. Then they'll all join together in that August, September time, and we'll be able to see, are there a couple of policies or strategies that cut across all three of these areas that somehow address health, transit, and affordability. So I think we're going to get to where there's that. And we'll also see, once that's all kind of packaged together and we're looking at it as one, if there are specific groups, let's say the people living with disabilities, that need a specific like policy or strategy direction to address them. So know that your work hasn't, that's kind of where we see this future process going. Definitely a work in progress. So thanks, Chris, for letting me build on that.
Absolutely. Thanks for that extra layer of understanding. And so from now on, we want to distinguish where EMAC is the driver in the driving seat and where EMAC is leading, and in particular where EMAC will be providing direct recommendations and input to OTC, as opposed to where ODOT staff are really kind of driving these the decisions, but in collaboration with EMAC, if you can kind of understand that distinction. And so every time that you see sort of this gold colored slide, this is an indicator of where EMAC is taking the lead and driving things, and where ODOT is here as ODOT staff are here as a resource to, for example, conduct research, writing, answering questions, and so on and so forth. So for one example here, moving forward, Garrett's going to talk about today's meal on neighborhood health and safety. And you'll note that this slide is not colored gold, but look out for those that are. So go ahead and take it away, Garrett.
Sure. I'll take the non-gold slide, definitely. So let's dive into today's meal, neighborhood health and safety. So again, similar question to transit multimodal. Where will I see ODOT's commitment to neighborhood health and safety investments? And so you'll see them at the strategic level, the policy level, or the mitigation level, which is informed by those performance measures. And going back to our butterfly analogies, you can see from the chrysalis to the fully formed adult butterfly, there's different levels of development that each one of these are in at the current moment. So these are the three documents that were provided with your packet that really help support this meeting. We try to learn from our April work session and reduce some of the page numbers on these, make them a little more concise. And we're going to do a walkthrough here in the meeting where we didn't do that in April because we heard feedback that folks didn't get to read through them and kind of were sent into the breakout rooms, not having all the information. So a strategy describes a process or a specific investment that is informed by the total project analysis, but goes above and beyond what is required in that mitigation level. And a policy is a statement or administrative rule used to guide decisions and identify actions in pursuit of an outcome, such as advancing equity. And so the interplay you'll see a lot of times between these two, for example, like the policy could dedicate money towards active transportation, but at the strategy level, you'll identify what are those specific investments within active transportation that we want to see, bike lanes or on a certain road or other types of things. It gets a little more specific. Next slide. So the next section of content we're going to go over is really informing discussion question number 1 in your breakout groups. So we'll walk through some of the key takeaways. There's 6 of them from the research document. The first takeaway is that the connection between transportation and health is broadly organized into these 4 categories: access to human needs, neighborhood livability, safety, and environmental quality. Traditionally, in the NEPA or that federal review process, factors such as air quality, noise, vibration, access to healthcare facilities, these are the traditional factors that have been studied and looked at. But as folks were understanding more about the interplay between public health and transportation decisions, there's a much more kind of integration of the health impact assessment, which is used in the public health world, to inform the transportation world and planning. There are a few examples where there is like a full-on health impact assessment, because health impact assessments have a whole range of different pieces that what make up an HIA. But different elements can be kind of selected and included to inform transportation work. And so this is a very large diagram here, and in no way am I expecting you to read the words on the screen. But this is a really kind of groundbreaking work here from the San Francisco Health Department in looking at a congestion pricing project where they're really looking at health outcomes and tying those directly to transportation decisions, policies, and strategies investments. And so this is a way that at a very coordinated level, you can kind of see the interplay between those between transportation decisions and how that might impact health outcomes in the long term in neighborhoods and communities. Key takeaway number 3 is that neighborhood health and safety through design elements or investment in communities such as noise walls, bike and pedestrian facilities, improvement to natural habitats, or funding outreach and education have been ways that you see the kind of strategic level investments or even mitigation level investments in communities with neighborhood health and safety. Reducing congestion on the highways can improve the lives of those living near them, which are disproportionately historically underserved or excluded communities. One of the key pieces of research in this field is that they were studying the change from coin-based toll booths to electronic tolls. And so because when they switched to electronic tolls and reduced that congestion on the highway, you actually saw birth weights in children living adjacent to the highway rose over a certain period of time. And so that can be that real direct health benefits by reducing congestion and cars idling on the highway. But you can't just reduce the highway congestion and send everybody to the side streets. And so that's the key thing, is you kind of have to look at air quality maybe from that regional level and what's going on the highway, but also studying the impact of diversion and air quality on areas adjacent to the highway. And so there's a link to, if you haven't looked into urban heat islands and the real negative effect that that can have beyond just air quality, and again, the location of where these urban heat islands are in our equity framework communities, we can see that as an example of the historic harm. And finally, this comes from an excellent research document, or this 2019 Community Health Needs Assessment by the Healthy Columbia Willamette Collaborative, which is our regional health group and agency. And they talk a lot about the connection in the Portland area of transportation and health. And so one of the key things they mentioned is that healthcare service access is a strength and a weakness in the Portland region, really depending on where you live. And they really call out that it's a challenge for residents of rural areas in getting that transportation access. And so those are the key 6 takeaways from the research. I want to say a huge thank you to Abe Mullen, Phil Wu, Francisco Ibarra, who was an intern on this project, and our wonderful facilitator, Chris Lepe, who did a lion's work of research that was put into this. You can see our footnotes. We'll submit for our doctorate, and hopefully we'll get that and join Dr. Wu one day on there. So thank you. We had even more research. Who would have thought that? So we looked at, we've been following these comparable examples, kind of regional tolling or bridge replacements. And so each one of these cities plus additional examples are highlighted in the research. Just highlighting Los Angeles as a way of this kind of cross-cutting policy. So they have a policy for active transportation, dedication of net revenue that goes to active transportation. And that money was then used to fund neighborhood health initiatives on the 110 Healthy Communities Project. And so again, that's one of those areas where I know we're talking about neighborhood health and safety today, but it's very much can be influenced and informed by our affordability and our transit and multimodal conversations. Okay, Chris, I'll turn it over to you for discussion question number 2.
There we go. Sorry, I was on mute. Thank you, Garrett. And so now diving into discussion question number 2. Again, so here we go into the gold slides, and this is where EMAC is going to be leading. And so first off, on the policy side, wanted to point to the trauma-informed practice statement, toll revenue dedication, looking at impacts from diversion and dedication to community-based organizations, and having a balanced approach for defining the corridor for investment. Also, toll exemptions, discounts, credits, or rebates for public emergency response vehicles, non-emergency medical transportation, which provides transportation to services such as primary care, behavioral health, urgent medical care, dental, dialysis, or special medical care. And then moving into strategy options, again, trauma-informed practice statement that says address historic disinvestment in communities adjacent to the highways that will be impacted by diversion to improve air quality and health through design elements or investment, and improve community health through the process and product of the toll system. So both the process and the product. And that includes design the toll system to lessen congestion on the highways, to improve the lives of those living near them, and take additional steps that than what is traditionally measured in the federal review process to connect transportation planning to health outcomes. So I'll hand it now over to Garrett for discussion question number 3.
Excellent. And so these are going to be focused on the performance measures and calling out one specific question from our NEPA SCUBA team meeting. So again, performance measures mitigation is a NEPA, or National Environmental Policy Act, term that addresses impacts identified in the environmental analysis and kind of are tied to the toll project. To reorient ourselves, remember the NEPA tree, the performance measures are the leaves. And they're really measuring kind of impact, benefits, and burdens. And then it's the goals and objectives and purpose and need are help identify where those investments, where that mitigation would be committed. So what are we learning about diversion on I-205? Because we don't yet have this technical level of analysis for the regional mobility pricing project, we're going to use the I-205 example as a kind of a parallel of what's going to happen in that future conversation. So specifically on I-205, we're learning that congestion on the highway is creating major diversion today, major impacts to economics, climate, health, and equity. 3 and 4 trips are made locally. So on this 7-mile stretch of I-205, 75% of the folks get on and get off one of those exits within the corridor. And then I kind of wrap this into the first question, but this is not just a local, but a statewide issue. This I-205, the Abernathy Bridge, and some of the seismic retrofits will be needed because this is one of the corridors that you would then get out to Redmond, which is the state emergency center for if there was a Cascadia event. So of the areas where we've looked at initial transportation data, we're really focusing in on 5 where we think diversion might be increased or impacting communities. And so the social resources maps are our best capture today of what's existing data-wise on social and community resources. And so what we're hoping to do is deepen these maps and inform them by your input. So what categories are we missing? Or for example, within like schools, how do we prioritize for equity? You know, so it'd be one thing to map all the schools out, but how do we know what are the schools that we want to look at kind of the most is from an equity standpoint? And so one of the feedback we got would to be maybe look at free and reduced lunch percentages or schools that receive Title I funding as a way to discern for equity. So we're looking for that type of feedback in these other categories as well. Next slide. So we had a wonderful NEPA SCUBA team deep dive with some folks, and I'm going to transition it now to Bill and Abe to kind of talk through some of the needs we're hearing out there now, and then just some of the feedback we heard at that, we came up with that at the meeting.
Thank you. So during our SCUBA team meeting, one of the things we really identified was dialysis. And so I was asked to speak a little bit more about dialysis and what it a person's journey could possibly look like and how that'd be impacted by tolls. So as I'm talking about this, I just want to point out that I'm not someone who has personally experienced this, but I'm someone who has learned from others. So take that as needed. So if someone who's doing a dialysis, they're going to go 3 times a week. It's going to be 3 round trips a week, and treatments last for about 4 hours. Sometimes the closest dialysis clinic is not always the one that the patient travels to. So up here in North County or in Clark County, we know that there's people who live north of Battleground and they're traveling all the way into Vancouver to receive dialysis, even though there's dialysis clinics in Battleground. The reason for that is the clinics get full up and they only have a certain amount of beds and certain amount of facilities, and they just don't have the capacity to add people, even though they make more sense due to proximity. Folks can spend around 20 hours a week traveling and receiving treatment to dialysis. If someone is late to be picked up, or their transportation, which could be paratransit or community transportation program or service, runs into traffic, that means their dialysis starts later. But the return trip is still scheduled for the same time. So this can lead to folks missing their return trip or making the decision that they will stop treatment sooner, which is a negative effect for them. If they do not stop treatment and they continue with their treatment, that means that their ride that is scheduled for a certain time has now been pushed back, and they're most likely going to be on will call. And so with will call, there's not a certain time when that person should be picked up. It could be a half an hour later, it could be an hour later, it could be 2 hours later. And then when you're using a community transportation program, it's not your personal vehicle. So if there's already folks on the vehicle, you might have to wait until they're dropped off and others are picked up before you finally reach your destination. So for a treatment that's supposed to last maybe 2 hours with a travel time of a half an hour on either side, so a 5-hour total trip, could easily balloon into like an 8 or 10-hour experience. And so one of the things that we were being cognizant of as we were talking about this is those special needs that folks who are traveling to dialysis could experience with the impacts of tolling, and how do we sort of mitigate those to the best of our ability. So that was our conversation on dialysis. Ride Connection in Portland has done a lot of great work around the needs of dialysis, and that's where a lot of my information came from. So I just wanted to point that out. And then we also talked a little bit more about the current needs. So we were just pointing out things that we didn't feel were adequately identified on the social resources maps. And so some examples of those are like family practice medical clinics, behavioral health, mental health clinics, local clinics, pharmacies, chiropractors, dentists, sort of the whole gamut of stuff, because folks hopefully are traveling to those local medical opportunities rather than waiting to the point where their medical needs are serious, where they have to travel to a hospital. So that's my 2 cents, and now I'll turn it over to Abe.
That was a great summary, Bill. The rest of the bullets that we see on the slide, really, I think our intent was to get at the social determinants of health or the social conditions that influence health. So Garrett already kind of touched on the Title I schools are for free and reduced lunch. I think we also talked a little bit about food pantries and other food distribution points and wanting to flag those. Thinking about locations that communicate social services, I think this could be reframed as like care navigators or care coordinators, or places where people go to be connected to other services, whether they're medical or social services. Thinking about affordable housing locations, both currently that exist and the future ones that are being planned in our region. And then looking at access to green spaces throughout the area, which is particularly relevant as we're heading into a very hot weekend. And those are really important resources for folks that might not have access to air conditioning, and those areas are significantly cooler. So I'll pass it back to, and I guess something else that we talked about too is just really wanting to gather community feedback around what is important to the areas impacted, and needing to integrate that and map it in our processes.
Definitely. Thank you, Abe. Thank you, Bill. Yeah, that network you just explained, Bill, that super complex. So I'm glad there's good people like yourself that are working on coordinating all that. All right, next slide. Great, Chris, take us away.
Yeah, and actually, Garrett, I had a question. Would it be okay to open it up for clarifying questions before we go into the breakout rooms, or?
Yeah, that works out. I think we're only about 5 minutes behind, so we should be okay if we want to spend a few minutes on clarification questions.
Okay, because that was a lot of content that just came your way, I know. But we're gonna have a chance to discussion in breakout rooms. But if there's anything that's more so a clarifying question, feel free to pose it now. Okay. Well, so no clarifying questions, it sounds. So let's talk about the breakout questions. So we're going to be breaking out into groups, and the three questions that we have before us is, what is your reaction to the key takeaways in the research document? So that's the first. Second is, based on your understanding of your community and the research, so your lived experience and your understanding of the community plus the research that's been brought to the table here, are these the policy or strategy options that should be advanced by EMAC for further consideration? And how can they be strengthened, or what's missing? And then finally, the third is building upon the feedback that you just heard from the NEPA SCUBA team on the social resources maps. What is ODOT missing? And beyond putting these social resources on a map, how would you deepen our understanding of the community and the impacts of tolling? So does that make sense? And Nick's gonna break us out into teams. I'm gonna be floating around, as I believe Lucinda as well will be doing. And can you, Garrett, can you remind us how much time we have? Is it 45 minutes or 40 minutes at this point? Yeah.
Yeah, I think 45. I think we'll give that, because we've heard that we want that in the breakout rooms, and then we'll reconvene there.
Okay.
Nick, any logistics as we're going?
Nope. Everybody enjoy your adventures. I'm going to send you to your rooms now and pull you back at about 4:47. Okay.
Sounds good, Nick. There might be a little bit of a gap here. We're having to wait around, so feel free to, turn off your screen, do a little stretch break if you need to.
And James, I don't know why that didn't send you to your room. So give me just a sec here, okay?
Hey, Nick.
Hey, how's it going?
Good. I just ended up jumping into this one when I was trying to get to one of the other rooms. So it's like teleportation.
It is.
I was just checking in on folks to make sure that they started recording. So 2 of the 3 groups I know have started. I'm gonna check on this last one, room 3.
Sounds good.
I'll see you in a little while.
And if you are watching on our YouTube live stream, just letting you know that we are about to reconvene in the main meeting at 4:47. So stick with us just a couple more minutes and the committee members will be right back. Thanks.
Hey there, Nick.
Hello, welcome back.
Hey. I think that was good. A lot of good discussion.
Excellent. Looks like people are going to start trickling back in. So we'll get started here in just another minute or two.
All right. So Nick, do we have everybody?
I think we're still waiting on a couple more people to trickle in. I know the public breakout room is wrapping up right now.
Sounds good. We'll hold on tight here. Actually, Nick, before we get going, how much time do we have for our large group discussion? Or Nicole or Ann, anybody else? Hannah?
15 minutes.
We got 15. Okay, so we're on track.
We were supposed to have 5 minutes of closing too, but yeah, I think that can be cut a little bit short. Doesn't typically take 5 minutes. So
okay, so maybe let's try to have each team aim for, 3 minutes or so. Report out. I hope that sounds good, and then we can open it up after the report outs for some gelling. So Nick, do we have everybody or?
I think you can go ahead. I know Garrett just popped in, so
Okay.
Good.
Welcome back, Garrett. And welcome back, everybody. I was jumping around different rooms, as you know, and I can tell you that one common thing, we'll be talking about common themes, is that each group had a lot of really robust discussion, a lot of good ideation going on. So let's start with group number 1. We're gonna report out here. And I think the first group, your high level kind of key takeaways from your discussion. And the following groups, maybe what we can do is if you have any common ground, any things that were mentioned from the prior group or the prior groups, call that out. And then if you want to add any plus ones, that'd be great. Does that sound good?
Sounds good to me. And I believe we were, Hannah's group was group 1. And so I'm going to share some of our, I think our top highlights from our conversation, and specifically around, reactions to the research document. Thank you for such a robust document. And we wanted to, double down on, we don't want to just move congestion around. And so we had a discussion around wanting to understand how tolling really impacts vehicle miles traveled, across highways and neighborhoods. And we don't want to just move congestion around, but understand, how's that impacting VMT overall, and also specifically single occupancy vehicles that are traveling on the system. We had a robust discussion around, how far will our diversion radius go when we're talking about diversion, like how far are we looking at? And then, what is our sort of definition or guidelines for where, investments could be made in that corridor. So we had a lot of discussion around that, and that, I think we had a strong understanding that it should be really beyond just the right of way where the highway is, and understanding that it's a connected system, with neighborhoods. And so understanding, all of that. And one suggestion would be that we could use Metro's definition for a travel corridor, and look at that whole system of where people, a lot of people are moving in between. And then I think we can go to the next question. I'll jog my memory here. Yes, and then here we had a really robust discussion about how are we talking about what amount of diversion is acceptable, or who is thinking about that and making those assertions around, what is an acceptable amount of diversion, recognizing that there's some diversion already happening. And so, we had a conversation around how much, diversion is being modeled. And, I think we're really eager to discuss that aspect more, and taking diversion modeling and putting it into regular vocabulary, and a people-centered focus around, what does that mean if there's more, vehicles going down a particular roadway. And then I think we can, and then we had a really robust discussion around small businesses as well. And so as we're, as the program changes, people's habits and encourages people to, walk, bike, or take transit, it's kind of, resetting the status quo of our transportation system. And so that, means that there could be new routes in communities that are then more popular for walking and biking. And that is an economic opportunity for those areas to see greater foot traffic. And we really talked about the importance of small businesses, and that they're good for our local economies and employment and jobs. And that, money that is spent at a local store often stays in that community and, keeps circulating in that local economy longer than if it is spent, at a big chain store or gas station, that is traditionally, you often most times see the big national chains, at the exits and entrances of highway ramps. And I think I'll conclude by, we had a really robust conversation too, around how access to, different social services is really important. And we added in that pharmacies should be included as well. And a lot of thought needs to be given to, are these accessible by walking and by transit? And is it, a safe and comfortable and joyful experience to access those in those ways? So really thinking beyond driving. And then we really wanted to double down on the importance of access to jobs. And that is what is on a lot of people's minds. And so we want to, make sure we honor that and really call out that the access to jobs is an important factor in, how we think about tolling overall and its impacts. And I invite anyone else from Group 1, if there's anything I, missed, feel free to fill in here.
I think you did a really great job. Is there anyone else from the group? Thank you. Great job, Michael.
That's great, Michael. And I'll just note that, the access to jobs piece is one of those examples where we're going to have overlap, right? Which is natural and good between these sort of compartmentalized concepts that we have here that are helping us dive deep. But at the end of the day, might or very well will get sort of smooshed together. So thank you for that. Group number 2.
I think group number 2 is my group. So yeah, Abe, go
I
ahead.
just wanted to confirm we were group 2. So I'll do my best to summarize here and connect some dots. We were excited by all the health and transportation connections. One gap that we talked about was the mental health connection. And so looking at how transportation systems either promote or negate social exclusion and isolation, and the stress that sitting in congestion or having to navigate congestion can create. And then wanting to translate that into our trauma-informed practices, and how do we create a toll system that promotes mental health and empowerment and safety for everybody involved. Jumping onto the VMT comment from earlier, that was also raised as a concern in one of the case studies from the research document, how the toll system didn't cause an increase in traffic volume in one of the case studies, and kind of a net status quo on traffic safety outcomes. And so wanting to make sure that the system we create works to reduce emissions and improve safety outcomes for all. And then is there anything else that I want to add here? I think we can move on to the next category area. Or these policy or strategy options that should be advanced for further consideration. So we talked a little bit about making sure that exemptions were made for low-income drivers in the neighborhood area. We talked about making sure nonprofit medical and other social need trips were included. And we talked about how the community knows best and wanting to lead community voice when it comes to designing programs that promote health. And so wanting to lean on them for developing health-related strategies, either in the 205 corridor or the regional corridor overall, and wanting to lead with the voices of those most impacted. And talked about the opportunities to connect all of the 3 domains, multimodal options, health and safety, and affordability, where there's a lot of overlap and connections between all of these categories and strategies, and also the ways that community-based organizations interact across those domains. We also talked about the need for more specificity around air quality monitoring and how this overlaps with opportunities to reduce climate change drivers. And then last one, so we talked about affordable housing, specifically multifamily housing, healthy food sources, including pharmacies. We talked a little bit about including other sources of air emissions in mapping from that might contribute to or exacerbate air quality impacts. And then kind of another +1 is just the conversation around job access across all modes, and both to small businesses and others. I think that about closes out the summary.
Perfect. Thank you, Abe. I could tell there from all the sticky notes you guys had really robust discussion. So we'll make sure to capture, or we have captured it. So thank you for that. Group number 2. How about group number 3?
Group number 3 was my group, and we did not get a volunteer. I think they were volunteering me. So is someone from my group want to highlight what our discussion? Or I can do it.
Or you could just call someone out, Ann.
Okay. Let's see. How about Amanda? Would it be okay to call on you? You gonna take my invitation, Amanda? I can help you.
I prefer not to, but
okay.
I thought we were going with the person that talked the least.
I don't want to call. I can go ahead and do it. I'll let you guys chime in. How about that? So on the research question, one thing that I heard, so I'll just be reflecting what I heard, was that it was just really important to take a holistic view. And so that was appreciated in what some of the research that was called out. And that led to a discussion about the need to have some sort of health impact assessment process where you're engaging with the community to really understand the community's perspective on health impacts. So we made sure we documented that. And then moving on to the strategies and policies, I do want to just highlight that everybody in the group was we didn't ask for a thumbs up, but was liking the ideas that were presented and was saying that these were things that they wanted to see more explored further. There's a couple of additions in the one related to toll exemptions, discounts, and credits, highlighting the need for volunteer drivers for doing driving to health, for instance, Meals on Wheels, or driving to health appointments would also receive some sort of exemption, discount, or credit from the toll. Another conversation we had was about freight and whether freight would having some sort of incentive to divert because they did not want to pay the toll. There was a thought that big freight trucks probably wouldn't be doing that, but what about small commercial trucks? Would they have an incentive because they're not wanting to add to their business costs? So we didn't know what the answer to that question is, but we felt like it was an important question to ask to understand whether any sort of commercial trucks would want to be diverting, and how do you prevent that from happening? And then this group took a different tact related to the social resource maps and looked at the question of really how do we understand the effects to communities. I mean, the maps are one way, and then other ways would be to do in-depth interviews, go to where people are, and then think about different personas of how people could be affected, and sort of think about it that way. So using other tools other than the maps to understand effects to communities. So with that, I'm going to see what I forgot in my group 3. Anything else to add?
I think that's pretty good.
Okay.
Yeah.
Okay, I think we're good then. Good, I'm good. I'm seeing smiles and head nods. All right, back to you, Chris.
Excellent. So we're going to move quickly here. I think we're going to, well, what do folks on our project team think about doing a toll? Should we punt for our next meeting?
Yeah, and Chris, real quick, can I share what I heard in the public group?
Oh yes, I'm so sorry. Go for it, Garrett.
Yeah, we had 7 members of the public. So north is Hayden Island, south in the Westland, Oregon City area. Just going to underscore things I heard there. How the corridor is defined and diversion impacts to areas not on the social resources map, small businesses, access to jobs, neighborhood air quality is important, and then the low income driving piece. And I think it kind of builds on this theme, which I think is really beautiful coming here, are some supports we see that are cross-cutting along all these policy areas. So that's the public group. And I'll just say my 2 cents, Chris. I think this, I'm so just awesomely overwhelmed and wonderful the amount of feedback that was having here. I thought the recaps that we went through and some of the areas we're building on were good themes. So I think I have direction as far as from the ODOT side on support we can provide you all between this meeting and the next to kind of get back on some of that.
I concur. And Garrett, can you remind us if we're going to have a scuba team meeting in between?
Yeah, so
that'll help.
and that's a good transition to kind of our next steps.
Yeah.
So we received your feedback here today on the performance measures. We had the scuba team meet before. In the next couple weeks, we're going to try to get kind of an ODOT response on what can be incorporated and into the project that then becomes the performance measures, becomes a part of the project. And those things that can't, kind of our rationale why. And so we'll provide that information. We'll kind of see if the scuba team wants to meet again to go through that. We're totally open to that. And then those kind of a week before and maybe even before that, hopefully, we'll get you the kind of those preferred policy and strategy options we heard about today to really chew on at your July 28th meeting at 3:30 p.m. So please complete the meeting evaluation. You'll get that here from Nick pretty soon. Get in contact with Hannah about those list of community-based organizations and that outreach plan that we looked at. And then reach out to myself if you have any comments about the tolling legislation and how that's moving through. And finally, we're only 5 minutes over, so we've got a second. But let's give Chris Lepe a round of applause. He did a wonderful job facilitating today and stepping in. You were top quality work, my friend.
Thank you very much. And I just want to say it's an honor to walk this path with you, not just today, but over the course of this project and this planning process. And I want to thank all of you, including the EMAC members, the project team, and the members of the public that joined us today. And I really look forward to seeing you guys next month. In the meantime, please take care and stay cool. Anything else, y'all? Project team?
No, man. Stay cool.
Right.
You got to end on that, Chris. We're good.
Bye, everybody.
Later on.